is Khan, and today I'm going to tell you about how to install and how to use the VeinPro desk type. So first of all, you open the box, and here you can see the desk type. So first of all, you take it out carefully. Be careful to hold the LED stand while you take it out. Okay, you see it like that, and then you turn the stand 90 degrees. Okay, careful to hold the camera and the LED, and then you move down this mount. Okay, there, that makes it firm and stable. And then here in the beginning, when you adjust it to number 3 for normal viewing, this can be adjusted according to the patient type. If the patient is very thin or like an infant, a very small hand, then it will be closer to the bottom surface. Then you can move the camera and the LED module a bit downwards for that. For people with thick arms and with a higher position for the viewing, then you have to move the camera module upwards. However, most of the time it will cover most of the patients when you put it at number 3. Okay, so after making it stable, okay, then you turn on the device, click on the power button for about 3 seconds, and you will see that it will turn on, and you have to wait until it loads properly. Okay, so after you turn on the device, you see now the program has loaded. And then here, in the beginning, when you install the device for the first time, the battery will be low, and then that is why we have the power cord. So in the beginning, we recommend you to charge the device fully before using without the power cord. Okay, and then also here's the hygienic pad here. You can put it here before use to keep the device clean from any contamination or any kind of dirty stuff. And if this hygienic pad becomes dirty, then you can change it to a new one. Okay. So right now, if you see at the screen, so right now you see that it is dark. Okay, so that is the normal standby mode. It is in dark mode. So now if you place your hand, you see that the brightness automatically adjusts to find the optimal brightness to see the veins. Okay, so in the beginning there is no need for any calibration of the device itself, of the camera, of the LED, because all that calibration has been done by us before we release the product to you. Okay, and here you have the options. Okay, so here this button here correspond to the region of interest. So right now you see here this is at the upper button, and you see this is the region of interest. Okay, if you want to observe your arm, for example, you want the region of interest to be narrower. Okay, narrower than the first beginning, because this region is very important, because it is the region in which the device uses in order to automatically adjust the brightness. So for example, if you go to the hand, you can also have it like this to see a smaller area. Okay, like that. Okay, for that one would be a bigger area. So for arm, we would recommend using this narrower area when you want to observe the veins. Okay, and then here you can also see the thickness of the vein you are interested in. For example, in the hand, you would be more interested in the thin capillary vein, so smaller region of interest. and then you see there, you see the capillary vein there. Okay, you can see the vein here. Okay, like that. Okay, and you want, if you want to see the normal vein for IV injection, and for phlebotomy, you see that this region here at the bottom, and then this one here for the normal size blood vessel can be used to see the vein. Okay. Okay, so there are also other options like zoom in and zoom out. Okay, so this, you can also refer to the manual for the detail, and for also this button is for the brightness control. So right now it's on automatic mode, so that means it's automatically adjusting the brightness, as you can see here. Okay. Okay, so here we also have the pause button, so that works to freeze the screen for and then you can also start again by pushing the play button. So if your patient, if the vein of your patient is very hard to see, in normal IV injection procedure, the nurses will apply a tourniquet to apply higher blood pressure. Then there will be a higher amount of blood, so it will be much easier to see the vein for during IV injection and for injection procedures. As you can see here, for example, like that. You can also apply the skin. You can also stretch the skin to be closer to the vein. For example, here, this is very faint right now, but if you apply some more pressure, you see that it becomes clearer. Okay, so for those, this will be very helpful when performing intravenous injections. Okay, so yeah, like that. You can see the thick veins also here. You can also see the thick veins. Okay, and if the patient has a lot of hairs, then our device, for those purposes, you need to move the hairs or make it in order to make the skin visible. Okay, there are no extra options to avoid or any calibration to not see the hairs, but you have to physically move the hair so that the skin will be visible and that the blood vessels will be visible. Okay, and okay, if there are really too much hair of the patient, then it might be also necessary to shave the patient before looking at the vein. But we recommend that you can just push the hair away from the target area in order to see the vein more clearly. Okay, so here you can see this. You can move away the hair little by little just to see the vein. Okay, and also you have to remember that your target area must be lower in height compared to your heart, so that there will be more blood flowing to the target area for better observation. Okay, thank you very much.